Welcome to 10th or Tuesday, episode number 12. Today is, I believe, the 47th day that the GOP has failed to repeal and replace Obamacare. My name is Michael Boldin. I'm joined by my good friend,
Michael Maharrey.
So, Mike, all the talk about repeal versus repeal and replace, our version is repeal and replace with nothing, right?
Right. Exactly.
But instead of waiting on Washington, D.C. to fix itself, which we don't actually expect, if you watched Rand Paul last week try to get a copy of the secret Obamacare replacement bill and get a copy of it, he was shunned and wasn't even allowed to do that. The approach that they're using in Washington, D.C. is very reminiscent of the passage of Obamacare in the first place, of the Patriot Act, of so many things in Washington, D.C. So we focus, of course, on things that can be done on the state level to undermine this type of federal control, even if, and in my view, when they decide to never really do what they're supposed to be doing. So one of the bills that we've been working on the last couple of years is called direct primary care. Mike, can you give us a little overview of what this is? And then we'll talk about how it's moving in a number of states around the country.
Yeah, I love this little piece of legislation because it's relatively simple. And a direct primary care agreement is simply a contractual agreement you have with the physician. So I'm just giving you an example. I go to Dr. X and I pay Dr. X a certain amount of money a month, say $60. And for that $60, I get unlimited office visits, unlimited consultations over the phone. I'll get certain medications, all included in that one price. And what this does for the healthcare industry is it drastically controls cost. These guys can get massive discounts on lab work. And so it controls costs. It gives me, and then along with that, most people would get like a high deductible catastrophic insurance plan where, if you get run over by a bus or something
so
like that.
A real cheap catastrophic plan to supplement this. I guess the idea is simply they know how much they're going to be spending on X amount of services, Dr. X, right? So then they can go to the providers for those services and negotiate bargains. Direct primary care, they're also called medical retainer agreements. So what a number of states we've seen have worked on are bills to actually remove direct primary care or medical retainer agreements from the state insurance code. So then it doesn't have all the onerous and heavy regulations that go along with that, again, helping drive the cost down. You have a one-on-one relationship with your doctor, and you don't have the insurance code, the massive insurance code and all the regulations that go with it between you and the doctor and interfering with choice and cost, right? Is that basically a good summary of it?
That's exactly what it does. And that's part of the reason they're able to control costs. It gets them outside of the insurance system. And we all know that, they've done studies where you can actually see that the Medicaid and all of these government interventions are driving up costs and prices. This gets the doctors out. It basically incentivizes these types of arrangements.
Like a cash payment. So I go to my dentist here and anyone in Los Angeles, drleedentist.com is my favorite. I go to a guy I think he takes insurance, but he is very happy to take cash credit card. I haven't tried Bitcoin or like a gold money account yet, but maybe at some point he will. But Dr. Lee Dentist, I go to his office. It's a one-on-one payment. It's the last time I went, I had a cavity filled, I had an X-ray, and I had a cleaning all for $99 cash. And when I went to the front, it wasn't, he was the guy who took my payment. He shook my hand, said, thank you for my business. I mean, it's not the same thing, but the idea of not working through the insurance companies can certainly bring costs down because I priced that out through my girlfriend Sarah's insurance at other doctors around the city. And through insurance, it was basically, or places that focused heavily on taking insurance, that same service would have been $200 to $300. So a guy who is going to focus on this type of one-on-one cash relationship with you is going to be able to lower the costs and I think increase the quality of the service too, right?
Yeah, absolutely. So this is the cost control that Obamacare promised and never did deliver, right?
Right?
That's what we were supposed to get from Obamacare,
right?
But this is why I love this bill so much. It basically opens doors. And if I had this option where I am, that's absolutely what I would do. I'm more than happy to pay a certain amount per month, knowing that I'm going to use it for, my basic prescriptions and when I get a cold or the flu. And then if I could get a high deductible insurance policy, if I need to have heart surgery again, well, I could afford that. I can't afford regular insurance. It's absolutely insane. So these are great bills, and they're moving by large margins in a number of states.
Yeah, it's almost unanimous everywhere we see it. You mentioned you'd love to get into this type of agreement. Well, hopefully you'll have a chance. It just passed the was it the Kentucky Senate 35-1, I think, and now it goes on to the state house.
Senate. Mm-hmm,
so
correct.
It just passed the state Senate, and then this past week it passed unanimously in the Georgia Senate. That was Senate Bill 50. A committee in Colorado also passed a direct primary care bill, House Bill 1115, a unanimous passage in committee as well. Another bill is on its way to the governor's desk in Virginia. I don't expect the governor to sign it, but I think it has a veto-proof majority there.
I think it does too. And what he did last year, this bill passed last year, and he did veto it. And what he wanted was a provision that it would have to pass again this year, and the legislature didn't want to do that. I guess in retrospect, maybe they should have.
Wow.
But so I'm wondering if maybe he'll let it go this time around. But it does
possible.
have a veto-proof majority, so hopefully he'll go ahead and sign that into law. I can't imagine, why would you not want people in your state to have a choice?
Well, I mean, if we're talking politicians,
right,
especially Terry McAuliffe, that guy really does not like people having free choice. I mean, he claims to be pro-choice, but I think he's anti-choice in 99.9% of issues. Bills like this, direct primary care, just moved out of the Georgia Senate, the Kentucky Senate. I think it passed unanimously a couple of weeks ago in the Indiana Senate or House. It was like a 99-1 or 100-1 there. Colorado committee, West Virginia House, to the governor's desk in Virginia. This is something that's moving very easily in a number of states, and we're certainly very supportive of anything that can help reduce costs on a one-to-one level or a local level, because it's never going to happen from Washington, D.C.
Right. When you have options in the state, when you have options where people can get in one-on-one agreements with their physicians, it basically takes the federal government out of the equation. And you'll always get, when you start talking about repealing Obamacare, it's unconstitutional. People say, well, we don't have anything to replace it. Well, yes, we do. We want the market to replace it. And that's the beauty of this bill. It opens up those market opportunities.
Repeal and replace with nothing. Absolutely. One other issue that we can actually talk about in relation to health freedom, there's many actually, but another one that we've been looking at in the last week or so is this bill that we've been monitoring over the last few years called the Right to Try Act. This essentially does an end run around a very restrictive FDA program that in essence lets people on their deathbed pass away rather than give a shot to something that has gone through some early stages of testing to say, you know what, I want to try this. I'm going to die anyways. Maybe it'll work. So you just gave testimony to a committee in Alaska on the Alaska Right to Try Act. Give us a little better overview, Mike, of what that bill is, what it does, the good stuff.
Yeah, well, exactly. It's exactly what you say. It creates a state process that allows people to access these experimental medications and treatments without having to go through the FDA process. And the FDA does have a process for people to do this, but it's onerous. A lot of people are not approved. It takes a long time. And, if you're somebody that is dealing with terminal cancer, you don't want to have to go through the FDA red tape in order to get treatment. So this opens the door. And I talked about this when I did the testimony for the Alaska committee last week. And I mentioned the fact that in Texas, we've actually seen the practical effects of this bill.
Right.
In Texas, there was a doctor who had an experimental cancer treatment. It was very successful. It's actually something that's already been approved in Europe. The clinical trial ended. The FDA had not given final approval yet. He said, hey, can I get an extension so my patients can continue with the treatment? The
FDA said no, right?
No. Yeah, the FDA said no. Fortunately, the Texas Right to Try bill had just passed, and more than 70 patients were able to continue treatment under that state law. So, that's 70 people that those are real human beings that had a disease that was being successfully treated. That basically the FDA was saying, well, we haven't
Too
got
bad, pal.
yeah, just deal with it. So it was so successful in Texas that now they're talking about expanding right to try not just to terminal patients, but patients dealing with chronic type
Yeah,
of.
that's awesome.
So yeah, outstanding, and I think the committee that I testified before in Alaska seemed very favorable toward the bill. The questions that were asked and the comments that were made by the committee members seemed positive. So hopefully that will move forward. They have a real difficult process in Alaska. They have to go through like 3 or 4 committees in each chamber, but so far so good out there. So
Our
hopefully it'll
good friend
pass.
Robert Scott Bell always refers to the FDA as the Fear and Death Administration. I think it
Exactly.
actually is very appropriate as far as terminology. If you're going to say, someone's dying, they're not. You don't have enough freedom to make that choice of whether you're going to risk. I mean, people are certainly allowed to take a risk of getting into a car, and that's a
Right.
very deadly, perspective. Sometimes too, especially here in cities like here in Los Angeles, you could
Right.
die at any time. Why can't they try a medication that might give them hope or a chance to
Yeah.
live? Interestingly enough, over the last couple of years, every time we've supported a Right to Try Act, we have seen either response directly to us or some published. It seemed I got the impression they were AMA or medical industry lobbyists that were saying, you know what, this is giving people false hope. There's
Right. I've
these
seen
these
that too.
bills will not help anybody. They're just the federal law is supreme. No one's going to be able to do this. There is no companies that are going to be willing to do it. No doctors who are willing to risk their licenses, for example. But now Texas, this doctor in Texas, certainly proves that wrong. And I know that Robert Scott Bell some time ago told me he went to a conference in Colorado talking about ways to implement it there as well. So it
Yeah.
sometimes takes a little bit of time, but it's certainly getting off the ground. If we look at marijuana, for example, in the early days after Prop 215 passed, just after I moved here to California, this was back in 1996, there were maybe just a handful of people that were using these medical marijuana cards, and now today
Right.
it's like it's so many people defying Washington D.C. and under the purview of state laws that actually also defy Washington D.C. There's no way the feds can do anything about it.
Yeah, absolutely. And who is the FDA to tell me what kind of hope I can have? I
Yeah.
think if I was dealing with some type of terminal illness, I would take some false hope over go, lie down in a bed and die. So that's just a stupid argument if you ask me.
I'm actually really impressed by this bill. It's a very narrow bill, and I've heard from some people, well, this isn't the most important thing, but it
Right.
certainly is a great blueprint. It shows that, it doesn't have to be just a right wing or a left wing thing. The idea of trying medications or using things like marijuana generally comes from the left, but the
Mm.
original bill was drafted by the Goldwater Institute, which
Right.
is no left-wing organization, and they've been pushing it all over the country. I think it's 32, 33 states, Mike, that passed this bill so far.
We're at 33 with a number of states now considering it during
Passed
this
into
legislation.
law,
Yeah.
33 states. And just this last week, the Washington State Senate passed it 49-0. That's Senate Bill 5035. Then the bill that you testified in Alaska, hopefully we'll see a vote on that soon. In Iowa, it just passed out of committee. That was Senate Bill or Senate File 404. In New Mexico, another bill passed out of committee. So this is something that left and right can agree on. It may be narrowly tailored, but the idea that, people should be able to make choices about how to care for themselves is extremely important, especially in the face of a Washington, D.C. establishment who says, people shouldn't have that type of choice, or they'll pretend, I guess. I get really stuck on this repeal and replace thing, so.
Right. And I like the fact, too, that it sets a precedent,
Yeah.
that, and this is what I said in my testimony before the committee in Alaska. I said, this is exactly what federalism, the idea that states have authority, this is what it's made for. You've got this
Awesome.
bureaucratic mess that is denying people treatment. This is an opportunity for the states to step up and fill that gap. And when people get used to looking somewhere else besides Washington, D.C., that's always a positive. So it sets a really good foundation to do other things. Why do we need the federal government to tell us how to do all kinds of different stuff? Let it go down to the state level. So when people get used to that mindset on something like this that's obvious, then maybe we'll start seeing pushback on things that maybe aren't so obvious.
Again, that's the Right to Try Act, and we're also supporting direct primary care bills or the Direct Primary Care Act. These are ways that you can help expand freedom of choice over health care, regardless of what happens in Washington, D.C. And the more this happens, it will undermine any type of federal control over these types of decisions that Washington may try to implement. So very positive things happening in a number of states. And Mike, you got any other? Oh, you just had a really great interview. It's just a total side note. I like that interview. You were on the Mike Slater Show, which I've been on a number of times over the years. He's down in San Diego. And you got a quick snippet before we head out?
Yeah, that was a fun interview. Basically, he wanted to talk about the bill that's pushing through the Alabama legislature that would eliminate marriage licenses.
Senate Bill 20.
And so we talked about the specifics of that. But I thought the more interesting part of the conversation is we got into, why more generally it's a good idea to get the federal government out of our lives. And, he asked the question, and it's the devil's advocate question of, what about people who want to define marriage in a certain way? What would you say to the conservatives, And I said, if you want to do A, B, and C, you have to remember that you're also giving the federal government power to do D, E, and F, which you're probably going to hate. So you're better off not giving it the power at all instead of creating more power for the federal government. So we got into this discussion about the dangers of federal power and the reason that power is decentralized in the first place. And I think that resonated well with Mike and his audience. So that was a good interview. I enjoyed it. And if people want to listen to it, I'll link to it in the show notes for this video.
Yeah, absolutely. Link to that as well. It was really a great interview. It's nice to see that Slater is covering. He sounded a little bit more radical in some of the things that he was saying in that interview.
Yeah, he did.
So that was really cool. I'm glad you were able to do that. And wow, I don't have like a really cool finish other than thank you so much for watching. Make sure 2 links for you. 10thamendmentcenter.com/register. That will keep you up to date either daily or weekly on all the things that we cover here as far as like news, nullification bills and reports. And then also 10thamendmentcenter.com/members will also ensure that you can support the work that we do here for as little as $2 a month. Thank you so much for watching. We'll see you next week here at 10th or Tuesday.